My name is Jin from SG Innovate, and we are a deep tech we are a catalyst for all deep tech collaborations and opportunities, and we're very happy to be collaborating with Sing Health for tonight's event on ChatGPT. Is it ready for health? We do a lot of events throughout the week at SG Innovate, so do please join us, and we hope to see you again very soon. Without further ado, I'll just invite our guests from Sing Health, Prof. Daniel Ting, who will be moderating this session, as well as our panelists onto stage. Thank you.
Thanks, Jean. So we'll get the panelists to go onto the stage. And hi, everyone. Thanks for coming. And as you know, like this topic, I think the whole world is talking about it. Like I don't think anyone who doesn't know ChatGPT here, by the way. The door is there? No, I'm just kidding. Yeah. Okay, anyway, like, so everyone is literally talking about it, ranging from like, a 12-year-old kids all the way to like, the elderlies, right? So I think this is one of the things that I thought is actually quite timely when we actually planned this, the event. We have a very star-studded team, as you can see, like from the whole entire healthcare ecosystem in Singapore. So I shall not hog the mic. I'll get the panelists to briefly introduce themselves. I know you guys already know who they are, but I'm just gonna go through the routine, and then we're gonna start the panel discussion. Thank you. So Tom, yeah.
Good evening, everybody. I'm Tom Kaufman. I'm the Dean at Duke NUS Medical School. I'm a kidney doctor by training and completely non-technical. So you'll be getting an interesting and naive point of view from me.
Hi, everybody. I'm Karen from Microsoft. Happy to take any questions that you might have later on ChatGPT.
Hi, my name is Wei Yang. I'm the Deputy Secretary for Technology at the Ministry of Health. So looking at all the different types of new technologies coming on the horizon and trying to figure out how to integrate that into our health systems in ways which are safe as well as cost-effective. Yeah.
Hi, I'm Zikin. I'm a Deputy Commissioner for the Personal Data Protection Commission, but I also wear a hat, and I head up a group in Infocom Media Development Authority that looks after data innovation and data protection. And one of the things that we do in my group is to look at the governance framework for responsible AI. We put out the Singapore's model framework. We have issued a AI Verify, a testing tool. Right, and now we are scrambling to figure out whether the work that we've done previously, are they still relevant in the world of large language models?
Thanks, guys. So I mean, so I'm just gonna go through, we have senior leaders from university settings. We have senior leaders from the industry, Microsoft, of course, right? OpenAI. We have senior leaders from Ministry of Health, right? And then, of course, the law, the one who catches us, who violates the data privacy. So make sure, when you speak to Zikin, be very careful. So yeah. Okay, so I just wanted to actually spend the first, the few minutes to ask, of course, ladies first, right? The one from Microsoft, the OpenAI, and lots of, Karen, we loves you, but we just wanted to know why Microsoft, you mentioned something that was actually quite interesting. Microsoft has already invested $1 billion into OpenAI back in 2019. But the news really has excited the world just a few weeks ago, just a few months ago in January, when he decided to commit another $10 billion into OpenAI. Can you tell us what is the motivations for Microsoft to do that with OpenAI? Yeah.
Yeah, sure. Thank you. So as I said, 2019, Microsoft had already invested $1 billion, and that was in line with its vision, right? If you look at some of the quotes that Satya Nadella gave, he said, AI is going to be embedded in everything. And so if you were to remove all this mumbo jumbo of AI away, what it basically means is that whatever data you're collecting, somebody is going to give you insights into that. If you look at, for example, all your WhatsApp messages, you want to find out, okay, some insights from that, or you want to find some information. How do you do it? You've got to literally scroll through. So this is where we are saying that AI is going to be embedded into every part of our life, right? So that's what Microsoft started in 2019, and we took baby steps because, AI models have to be trained, and we've been working on AI models for very long. But the reason why it became super popular is because of the generative nature. We call it generative AI, wherein it begins to mimic human speech. It begins to mimic human way of answering things. And so it took, I would say, quite some time, you can imagine from 2019, even before that, to, let's say, 2023 or 2022 to actually kind of explode. And I think the likability of that is what made it so popular, because you could give it a question in human language. I'm sure you've read so many examples. My personal one, I remember one client who came to our office and he said, "I'm depressed. What should I do?" And I was impressed with the answers that ChatGPT gave, because it gave like 6 things. You can do this, you can do that, you can do this. And they were not like, vague answers, like may not be relevant. They were very, very sensible answers. So I think that's one of the reasons why it's more likable now, because I would say the applicability, the usability in every, walk of life is kind of increased. And people are experimenting, right? Or consumers are experimenting. They're trying to find out what it cannot do. Right, and it's an ongoing learning process for now GPT-4 as well, where it's learning from tons of data that people are generating. And I think in a way it makes sense. It's a unifying force, because all of us through our smart devices generate tons of data, right? So there has to be something that helps us, other than the search part. There has to be something that helps us make sense of that, right? And so I think that is where GPT-4 really becomes very interesting.
Yeah, thanks, Karen. Sorry, this is not ChatGPT. No worries. It's not jumping off from you. Don't worry. Yeah. All right. Yeah. Thanks for sharing that. I think that's very interesting. Actually, in fact, when I first came across the GPT technologies is when I went to Duke, and Larry Kareen, who was the vice provost for Duke University back then, he actually showed us GPT could actually write the second and third page in New Yorker's magazine. I'm not sure how many of you actually read, the New Yorkers. It's actually a very famous magazine in the United States, and GPT 2.0 back then can already do that, right? Of course, now fast forward to now 4.0. And I just wanted to kind of ask Wei Yang, coming into the healthcare space. So, based on what Karen has shared, how do you see this is going to create opportunities for the healthcare users in leveraging and in this a very powerful tool to benefit our patients' care? Yeah, William.
Yeah. No, I think when we look at every technology that comes along, we both look at what it affords, as well as what are its potential pitfalls. I think those are things that we always have to make an assessment of. I think you've heard me say this before. I've always said that AI in medical care can't be artificial intelligence. It must be about augmented intelligence, right? Which is how we use these tools to augment what the doctors already can do, make them become more effective and more efficient, but more importantly also to harness the wisdom of the doctors back into the system, so that the doctors in a way through peer support, for lack of a better word, actually help each other to make better decisions. But of course that requires then a certain, it's just like the current structures that we have. The SMC, so make sure that all doctors don't, sign their practice. Of course, they also accept that doctors are human, and some of these judgment calls are made, and you don't overly penalize judgment calls, based on the facts that were available at that point in time and so on. So then the question is, as we look at something like ChatGPT, is there a role for it to play in terms of, just trying to generate, let's say, based on the records of the individual, a summary report? Right, that could actually be quite helpful for the doctor, instead of trying to read through all the actual medical records, to have a sense of, okay, so these are some key things I need to understand. And of course, if it is one of those routine cases that the doctor has been an assessment of, it can potentially help you to generate some sort of report as well that allows him to give this report to the patient to read and understand without him having to spend a lot of time trying to explain. Right, in a very human way and so on. So I think those are, to me, some of the things I can immediately see, which have very low risk in some sense, but potentially could save a lot of time and actually improve the efficiency of doctors. I don't see this replacing doctors because in the end, whatever we generate came from somewhere. And that corpus of knowledge we need to keep building and rebuilding and updating. And the only people who can really do that well at this point in time, until AI goes to the next level, is ultimately still the doctors. And the doctors interacting with the patients, interacting with the different cases that may surface. But of course, there will be some cases which are a little bit more common and which we can then accept that maybe some of these tools can help us be a lot more effective while maintaining the human touch and the humane way of that doctors actually would, in a way, thirst for. So to me, that's how I can see that already potentially helping us think of how it helps the healthcare sector. But in all my interactions with the healthcare sector, we understand that doctors can also sometimes be a little bit more cautious about technology. And until they themselves see the value and benefit of it, it will probably not be something that gets adopted immediately. But I thought no harm in getting them to understand and see, and maybe designing a space where some of this, in a way, it's a more customized model that perhaps looks through the notes that the doctors may have generated. But as you all know, this itself is potentially a sensitive topic, because doctor notes are very confidential to the doctor themselves. So without that set of corpus of knowledge, then the question is actually whether some of these tools can be as accurate as we'd like it to be. But if there's a way to then think of this as a way for us to pass on the learnings of one generation to the next, because in the end, the AI models don't look at the specifics, they look at the generalizable trends across a whole range of data, and then they extract out what is the norm. I think there is still that room for us to have that discussion with doctors. But I think more importantly, it is then to tell the doctors, please don't go on autopilot, right? That whatever is generated, you still have to make a judgment call and sign off and take the responsibility for that sign off. And more importantly, part of your role is not to highlight the cases or the issues where this general report doesn't quite cover. And of course, in that process, the model will learn, right? But to me, that's how we see and make use of AI as an augmented intelligence tool going forward.
Yeah, thanks, Ray. I think that's really important to actually, the point that you make, right? AI as a augmentation tool, right? So basically how it actually make us smarter, right? I think this is really important. And what about in the university settings, right? Tom, you're like a dean of Duke NUS, and with the GPT 4.0 or ChatGPT, are you gonna actually have like a meeting with all your senior leadership in Duke NUS to say that, hey guys, I think this is something that we must have in the medical school curriculum for the next 5 years, in Duke NUS. How do you think ChatGPT could play a role in the medical education for, in the medical school settings?
Great question. Try again. Great. Let me say again, great question.
Thank you.
I think, from the standpoint of a medical school where our job is to train doctors, we have to anticipate, there are a couple of things. One, we have to anticipate how it's going to be used in medicine and prepare students and new practitioners for being able to use the tool responsibly, understanding what it can do, what it can't do, and presenting that in what is already a very tight curriculum. And I think, students, we're not going to teach or make sure students know how to code, but we want to make sure that they understand the pros and cons and basically how it works. I think, it's, my sort of aha moment with it, I'm a nephrologist, a kidney doctor, and I've written, textbooks for, and so I did the thing, to ChatGPT quotes, write me a chapter about kidney disease, and in 5 seconds you get this thing that's pretty respectable. Or you put in a patient case. Here's a few details about a patient and their problems. And again, 5 seconds you get this very robust differential diagnosis of what the possible problems are, and it's it's pretty reasonable. It's still there's decisions to make after that, but this is going to be a tool that all the students have their phones on the wards and the other doctors, and this is really going to be a disruptive tool to use at the bedside. I don't think we've even scratched the surface on what the potential applications are going to be. But so our role as educators is to try and prepare students who are often more tech savvy than we are for how to use the tool. I would say to amplify what was said, in other places, one of the real applications in medicine, I think, is to remove the burden of clerical work from doctors and from other clinicians so that they can really concentrate on what is the essence of medicine, which are the humanistic interactions between doctor and patient and clinician and patient. And there's going to be real value in that. And I think we're going to have to suspend our disbelief a little bit in order to take full advantage of that. But we can discuss this more. But I think this is how we're approaching. I mean, the other point, which is as educators, is, you know, we have students that are going to be able to use this, and so do we let them use it as part of the education process, or we tell them they can't use it, they have to do it themselves? We can't do that. The latter is not optional. So I think we have to figure out how to incorporate that into for students who are going to be producing educational projects and being evaluated on them. And I think, I mean, our approach is that, and the approach generally at NUS is, yes, you can use it, just acknowledge when you're using it, and you know, pros and cons, and because that is, as was said, the question is going to be able to, how do you use this and make decisions about it, which is going to be the human part of the equation. But
Do you think like the open book exam is going to go obsolete now with ChatGPT? Is there even any point to have open book exams? Well, I don't know, like USMLE, they passed the USMLE exam, the bar exams, right? They're all been written. I'm not sure.
Well, I mean, I would say, you know, we do this, I'll let this answer, but I mean, in our curriculum, we have, in the classroom part of our curriculum, we have open internet exams, right? I mean, because when you're a doctor making decisions at the bedside, you've got your phone, I mean, you have access to this. So I mean, really the situation is you've got to be able to take all this information, synthesize it, and use it to make decisions. So the memorization part of the curriculum, I think, becomes much less important. And so, yeah, I think, you know, this is going to have to be incorporated into our assessments. Now, how we do that exactly is going to be a little more complicated.
Yeah, no, I'm reminded that my professor once said, he asked us whether we wanted an open book or closed book exam, right? And then most people actually said open book. Then he said, are you sure? It's going to be much harder. Because the reality is that closed book exams tested you for things like knowledge, memory, and all the other things. Whereas once it's open book, you've got to test concepts and you know, some of the things. But more importantly, in the age of Google, you know, now ChatGPT, what do we test, right? And it could be that you'll get a lot more trick questions. You know, I ask you a question, you can ChatGPT, and then the answer is going to be wrong. Right, but so the question is going to be more difficult, but that's precisely also where the human mind is able to do things that, you know, otherwise the computer still can't do. Right? And whatever we generate out of the computer is based on the corpus of knowledge that have been built up by human minds in the first place. But of course, you are right to say that as some of the things develop, the computers themselves will generate more knowledge as well. Then the question is actually whether we see that as walking alongside us. But in the end, some of the critical decisions, some of the turning points, some of the inflection points, ultimately still requires some sort of discussion, some sort of creativity, and some way of then validating that, you know, as part of this whole discipline of how we go about thinking of knowledge going forward.
Yeah, thanks, Ray. I think that's very important, right? Like, we are talking about using ChatGPT to answer the exam questions. Zikin, do you think we can use ChatGPT to generate exam questions, like the bar exams? Can we use ChatGPT to generate questions for your future generations of lawyers, like in a law school? Well, what do you think?
No, actually, this is a great question. It brings us back to what is generative AI and what is not, right? We play around with ChatGPT. It responds to us, right? And it gives us fairly convincing answer that's written very well. But for those of us who actually know the subject matter, actually there are a few nuggets, a few minds in there. It's not entirely accurate, because all it does is actually predict what sequence of words should come together based on what it has learned. Yeah. It's not a search engine, right? So I would actually say I wouldn't trust it to generate answers. But if you gave it a model answer and say, can you please generate a question? That's prompt engineering done right? Yeah. And I've actually played around with it that way. We do a a panel like this. We do a conference that runs 2 days, and I always end up doing the panel subject matter. And we can come up with the bullet points of what to say, but I tell you, I can never write that one para synopsis that goes into the program.
You're right.
That's the most painful part. But you know, in like 5 minutes, because we've got all the bullet points, I use ChatGPT and say, from these bullet points, generate a 1 para description of this panel that I can put in the program. Perfect. Because you've got the answer, it can generate the summary, right? And I would say that yes, we need to know, it goes back to, we need to understand what it is and what it isn't, and we need to be clear about how we are using it. And I think that's how we can really unleash its power.
So really it's about the prompts, right? How do you actually make the prompts accurate and to guide the prompts to generate the things that you think is something that you truly wanted to ask, right? Since you're having the mic there, right? Coming from, again, the law, commissioners, you mentioned that. Do you see that as a risk, right? I mean, what was the potential risk, or do you feel worried about this technology? I don't know, like Karen, I saw Karen staring at me, but no offense, like, relax, Karen. I was just saying, like, is there any risks or challenges that we should be aware of? Like, this is an open platform. Anything that you type is exposed to OpenAI, of course. I mean, not to the world. What is some of the things that we should be looking out for?
No, actually, I'll look at the risks in maybe from if you're a company that wants to use it, right? If you're a consumer that's playing around with it, right? I think for a consumer that's playing around with ChatGPT, constant reminder, it's not a search engine. Don't treat it like a search engine. It may give you very convincing answers, but it is not a search engine. It's not going to give you the correct answer, right? If you are a company that's trying to make use of it, then I think it's beholden on you to understand what role it plays. Generative AI does, generate text very well. You need to understand that's what it does, right? So if you're going to use it, and we have numerous examples of how it is pretty good at summarizing, right? So if you're going to use it for summaries, that's a good start. If you're going to use it to generate a medical report, think harder, right? If you're going to use, so you need to understand what it can and cannot do. The second is just because ChatGPT is a nice toy, you can play around with it. If you're a company and you're going to make serious use of it, you need to understand the plumbings, right? Is a large language model that you just call APIs for good enough for your product and for your service? That's the kind of risk you need to think about. Do you actually need to get the right set of expertise to understand how, for example, you can go beyond just prompt engineering to corpus engineering, right? Get your own data sets, right? To kind of build a domain-specific model that works together with it so that you get better quality results. You need to understand, because it goes back to what we do, right, which is AI governance. You need to understand what the model can do. You need to understand what use case that you're putting it for, and you need to understand where your responsibility is, because you are responsible for certain parts, even though you're using the model that's provided and you're making API calls. So I think understanding, right, how you're going to use it will give you a better idea of the risks. Then you're better able to once you can identify the risk, you're in a position to remediate.
Yeah, thanks again. I think it's really important, right? That's coming from technology governance and data governance. What about the clinical governance, Wei Yang? I mean, in healthcare settings, what are some of the structures or framework that is really important for us to put in place to kind of mitigate or to reduce the harm or like the unintended consequences that's being generated by this highly promising technology?
No, I think it goes back to, in the end, I think right now we are still in a situation where we look at let's say each doctor is in a way responsible for what they give in terms of their diagnosis and so on, based on their best duty of care in some sense, right? And of course, whatever data you can generate, you make the best sense of it, and then you make a call. And of course, if it's not egregiously wrong, we accept that. So some of the things we have to then measure, okay, so but what is already our current standard of what we expect? Then when we were to use the technology like this, then what exactly are we saying we will accept or not accept, right? Are we saying that the doctor can just say, ChatGPT generate a report for me, and then he just sends it without even reading it, without even editing it, without even signing off on it? Or do we say it's okay as long as he looks through it, makes adjustments, and then signs off on it? And more importantly, if he actually makes adjustments, I'm actually also wondering whether that, like this customization for a specific domain becomes part of another filter layer that is specific to that particular use case. So I can imagine that the general model will keep evolving based on how Microsoft might develop it. But in each of these use cases, if there's a way to actually then say, okay, based on the adjustments, edits, the sort of like insights that this particular group of people keep doing for over this set of data that they're using, that there's an overlay that can be applied within that setting. And then that becomes the IP of that organization. But in that process, there's also greater trust and greater sort of like willingness to say that, okay, whatever it generates is probably as good as it gets. And of course, governance, audit frameworks, do I then say that I actually look through all of them and see which ones the doctors made some changes and they were correct, which ones the doctors should have made some changes and didn't, right? And that itself can also be part of that governance framework that we may need to put in place, but which itself would then be contributory. So don't think of this as regulatory burden, but think of this as contributing to the insights overlay that I talk about for that particular sector that actually would help to improve both the confidence in that particular use case, as well as actually deal with some of the governance and I would say responsibility issues that will then come with the use of a tool like this. So, I mean, I always say, I look at technologies all the time, and one of the things I always say is that, well, technology is like fire. Fire can burn down a house, it can also keep all of us warm, and make sure the food is cooked and all the germs are gone, right? So it's how you use it, but you need to know what it can and cannot do, and what are the pitfalls, right? And then make sure that the governance structures actually look for that. So I don't see it replacing doctors anytime soon. It could make patients ask more intelligent questions that actually don't frustrate the doctors as much. I potentially see that as one value. No, because you ask very basic questions, the doctor, because of this human interaction, feels obliged to answer, but actually he's like, well, no, you're just not. Right? So, but actually, if in the first place you get some sort of report of your own condition, you get a sense, you understand, then you ask the question again, I've read all these things, but these things don't seem to apply to me because of A, B, C, D. Then it becomes actually an interesting conversation from a doctor's perspective as well. So I thought identifying the use cases, the areas where it can be usable, I think will be important. Then, of course, have some way of also acknowledging that maybe a ChatGPT tool had been used to generate some of these reports, I think will also be important, because that also sets the expectation of individuals as well. That's, again, part of the clinical governance, right? So which is to say that, okay, this one, edited and signed by a doctor. This one, no, it was just a generic report. Please use it with care. Again, those are some things I think we have to put in as a part of the system to ensure that people are not just using this the tools without thinking and without taking responsibility for it.
Yeah, thanks, Ray. When you actually mentioned about, in your mind, you may not be able to replace doctor. I see a big smile in Tom's face. Tom, what do you think? Is ChatGPT going to replace us, the kidney doctors? What's going to happen to us?
A couple of views on this, but I think it's illuminating that OpenAI, when they were first started, decided they were going to start a large fund to help support people who are going to lose their jobs based on the development of AI. And I think it's, there are going to be tasks that are going to be replaced by this sort of technology and its progeny. But I do think, and I sort of reiterate what I said earlier, is that there is, in medicine, the human interaction and there is a healing component to that, and that I don't think can be replaced. I think just to follow up a little bit on how this is going to work, and and the impact. I mean, so like in other fields, but maybe certainly in the last couple of years more than others, there's a huge problem with burnout in medicine across the board, and it's been shown that one of the things that drives frustration and burnout is incorporation of electronic health records, which is really important and valuable within health systems. So you can manage these broad, patient data records, but the human interface with that, it ends up being the doctors or the nurses and clinicians who are at the keyboard entering data and typing up reports, and it becomes very frustrating. And these things are imperfect in terms of their human interface. And so I think one of the really promising approaches to using these tools is you've got these electronic health records, and we're seeing this now in some health systems where you got, years and years of patient data, hundreds of thousands of patients, that where you can use these tools to generate reports. I mean, they're drafts, and yes, they have to be edited and signed off on by the clinicians. But just for those of you who don't work in healthcare, typically you've got a patient that's been seen in another hospital for 5 years. So you've got a mountain of records that you have to go through. And typically you assign the medical student to do that, right, when you're doing something else. But you can imagine these tools, they sort through it. They can, in a heartbeat, create this record of what's happened. You can make, beautiful tables for, sort of organizing it. And it really does relieve this. It's really a clerical burden that should not be part of this professional relationship, and should not be part of the physician-patient relationship, where you can concentrate on the patient's questions, who they often have legitimate questions that come from naivete. So I see that as one of many, but really a major positive development in this. But from the regulatory standpoint, we have to figure out how to allow it to interface with these confidential patient records in a way that you can use the tool. I'd be interested in hearing how you would say that. But I think in closed systems where the health system, the electronic record is closed itself, that may be easier. But I'd be interested in hearing what you think about it, because I think this is a place where it could be really be useful.
I'd like to respond.
Yeah, Karen. Yeah.
Okay, so a couple of things, and very nice to be sandwiched between doctors. Yeah, you see.
We're flanking you, Karen. We're flanking you.
No. But I just want to kind of share three things, right? So the first thing is that AI, or for that matter, GPT-4, is not autopilot. It's always a co-pilot. And if you wind back 4 to 5 years ago when AI came on the scene, we had the same conversation. Would radiologists get replaced? Until today, nobody got replaced. So the first thing is what everybody's been sharing. It's to increase productivity of doctors. That's number one, foremost. Secondly, in healthcare, I don't know if you'd agree with me, but healthcare data is one of the richest data sets on planet Earth. And you may say, why? Because it has all forms of data. You have clinical data, you have financial data, you have demographic data, you have social demographic as well, like your wellness and all. So it is one of the most richest data set. And so most of the hackers, if I can call them, love to kind of lay their hands on that information, right? You have your personal info, your IC, your passport, right? And so that is where it becomes very important for us to kind of summarize data in a very secure fashion. So as what you were sharing, when you go and see a doctor, and if you have a comorbidity, right, you have data from 10 years. Forget the whole EMR, EHR system. Even for one individual, the data runs for 10 years and across different doctors. So what we do have today, and if you're happy, we can always demo it, where the doctor can see a beautiful chart, a summary in a graphic form, not even in a tabular form, but in a graphic form. So it's easy for them to understand where did this patient start from and where are we today, what has been the progress. Typically when you go to see doctors, they turn their screen around and they show you these graphs running up and graphs running down and so on. So this makes it even easier for the doctors to look at the whole progress of their patient in the form of a graph, right? And the other two things that I wanted to share is, one, I'm sure you've heard of nuance. where it's speech to text, and I think that's where you mentioned that you don't have to do typing anymore. If any of you are aware of HIMSS, which is the health conference that's coming up next week, Microsoft is announcing what is called a Nuance and ChatGPT collaboration. So what all that the doctor needs to do is to talk to the patient. Nuance DAX will transcribe it into text, and you have GPT for summarizing all of that. They're not replacing the doctor, they're just saying, hey doc, based on what you're sharing with the patient now and the past records, this is what we can see. Of course, always the doctor has to say, yes, it's okay, or no, I need to edit it. It's never that, what AI says is going to be final, because after all, human brain is just irreplaceable, right? So to the point back that it is copilot, it is not autopilot. And the other thing, I think one of you were sharing on the custom models, Microsoft has also launched the Azure AI open source. So what it says is that you can take the custom AI and bring it into your applications. You don't have to sit and build out the algorithm. You can take a custom AI and kind of build it into whatever application you're developing. And to demonstrate that, Microsoft has kind of put ChatGPT into all the Office suite. So imagine you don't have to worry your head about making a PowerPoint that my son breaks his head over. ChatGPT will recommend to you and put the data together in beautiful PowerPoint. And in my office, I had a very simple problem. We work across JPAG, right? So you have a Korean or a Japanese trying to write a good email in English. Now what they need to do is just write it beautifully in Japanese and then use ChatGPT to kind of get that in English. Say, hey, I want to write this, and this is what I would like you to add as point. So I think there are multiple users, and those of you who do coding, you go to GitHub, right? You can use ChatGPT to kind of minimize the amount of time you're spending in coding. Of course, it does not replace learning, but it's like a tool for you to work with, right? And in Excel, how many of us have struggled with Excel, right? So here you say, hey, I would like to have this data all summarized neatly into tables, and there you give it this thing, and it gives you all that information. So Microsoft is working in kind of embedding all the products that they have with intelligence, and that's where I think we come in with ChatGPT. And no way does it replace human wisdom. It just makes us more productive. So as what you shared, we don't do mundane jobs and send students to probably do some of those. Those guys are busy of studying than probably doing all this. So I think sooner or later, when we have in a few years' time the same panel, all of us will be using AI in some form or the other, right? So that's how we are headed to.
Yeah, thanks, Karen. Zikin, you have...
I want to pick up a couple of points both Tom and I think Karen mentioned as well. I think it's really important for us to be clear about how we are integrating this technology. We'll stick with the medical health records, right, as an example. Because we've always advocated, right, design your human-machine interaction well. Human in the loop, human over the loop, human out of the loop, right? I think today, it's quite clear for healthcare, human in the loop. But I think even if human in the loop, what's the best way of utilizing the potential? We talked about it can do a great summary, right? Especially your 10 years history. It can do a great summary for you, right? But again, think of the workflow. This might be useful at the early stage when you are just starting your engagement with the patient. That summary helps you, right? But is it a substitute for the engagement and the diagnosis and figuring out what potential line of inquiry you want to go for? It's not. But later on, when you kind of like have a better idea that the problem is in this line of inquiry, then the summary may not be good enough because summaries are summaries, right? It may miss certain things. You might then need to have the ChatGPT or GPT-4 tuned for a different function, which is a more pinpoint inquiry to see whether certain things in the health records, right, whether certain things are present or not in the health record. Again, it helps you, right, or helps the physician to do that, right? And then, of course, finally, we talked about generating a summary report. And this is where I want to make 2 points, right? One tongue-in-cheek and one more serious, right?
Serious.
Yeah. The one...
Give us the entree first and then the main course.
Yeah, you figure out which one is serious and which one is tongue-in-cheek. You see, you can generate a report, right? And we all know that it's always harder to edit the work that someone else gives us, right? Especially when it's not 100% accurate. right? If someone gave me a 3-paragraph thing, I might actually take more time editing it for inaccuracies than if I were to just sit down and just write it out, right? The other thing is, how did I get to this stage that I'm able to just write something out in 2-3 paragraphs very quickly? Years of training, right? So which one is the tongue-in-cheek and which one is the serious one? Because I think that if we are too dependent on this kind of technology, we lose that skill to be able to press and write something very quickly, very briefly, and very succinctly.
Yeah, thanks, Sukin. Like, actually, I just want to, on that point, right? I'm just wondering, before the Ministry Health portfolio, you were in MOE, right? Ministry of Education. What shall we teach the kids, in primary school, right? Shall we get them to learn 3 different languages? Like what Karen said, right? They can write like a beautiful Japanese and then just translate in beautiful English. Like to Tom, should we even teach the medical students anatomy these days, right? There's so many muscles that I can't even remember a single muscles now apart from the eye muscles. What shall we teach the kids, the medical student these days, right? Like I have like a 6-year-old kid and one turning 1. This is some of the things I constantly are thinking about. Like, I wonder like whether you have any comments on that.
Yeah. So I was actually in MOE 2010 to 2015. And actually just before I went there, at the time the Director General of Education, Ho Ping, had actually written up the desired outcomes of education in 2009, I think. You actually try to read the document, you realize that the Ministry of Education, at least at the highest level, had decided that given where we are, what we need to teach our kids are very different from what we used to teach our kids, right? So it was about critical and inventive inquiry thinking. It was about cross-cultural communication skills. It was about ability to actually, in a way, work as a team and actually be able to do some of these things. So actually the reality is that in the age of Mr. Google, knowledge regurgitation may itself not have as much value as in the past. But yet, as we look through it, the question is actually, why did we do this knowledge regurgitation things? Why did we ask our people to learn 2 languages? Yes, there were some cultural elements that say, okay, because we were different populations, we had English as a working language, we wanted people to have their mother tongue. Mother tongue was actually a good way to, convey values. And so we continued to teach mother tongue and the conveyance of values through the mother tongue. Now, then the question is actually, why do we make people memorize? Memorization, for lack of a better word, is like expanding the ROM and the RAM in your brain, right? You remember a lot of things because you were forced to remember. By the time that you are done, you forget everything. But now you have memory registers in your brain that allow you to hold much larger concepts, much more data, and process them as part of your processing power. Now, I can say I don't need to memorize anymore, but the question is then, how do I then replicate these training mechanisms that allow me to still develop the brain to be as powerful as what it used to be? There are a lot of people who protest about writing and so on, right? But the reality is that, you know why writing notes allows you to learn the material much better? Or it seems to be. That's because you write your exams. And when you start writing it and try memorizing as you write it, your brain remembers both the hand action as well as that idea. And then when you try to write it again, that writing re-triggers that memory. Okay, your brain is actually quite smart and well interconnected. Now, then of course, if you type and you do everything by typing, when you actually write exam, you can't. But if you type, but you do exam in typing, that's perfectly fine. So the question is also, what are we setting up ourselves for? How are we teaching and how are we operating and how are we assessing? To me, they're all integrated and actually sort of like connected, right? And we need to be clear when we test someone, what are we testing and why are we testing for, but also understand how the human mind, the brain works, in order for us not to lose something in the process, even as we say that it actually helps us to do some things better, right? So I also actually going to speak to that, so it's good you asked me the question, because indeed those are some of the things that we have to think about. But yeah, at the same time, because you have some of these tools, the question is actually whether the training is now about the higher order skills, that we're not able to do. Indeed, trying to edit someone's work is difficult, but maybe that itself is a skill that is actually quite important, maybe helps us to reflect, because even you write something, you go back and edit it again, that willingness to edit a piece of work is actually part of generating a reflective mind, for example. So it then goes back to actually in the end, what are we trying to create? How do we do that? Is this, for example, if let's say now, like you say, the junior doctors following the M1 arounds and so on, is actually able to ChatGPT a lot of stuff, which is good, because then now the questions they ask, they say, but based on some of the things, it is like this, but why are you doing that? Those actually then increase the learning cycles of even our doctors in training. And again, it goes back to understanding what the affordances of the technology is, how do we use it, and then of course convincing the people who are going to interact with it that actually this is a better outcome or this is a better approach. And being willing to debate with some of them to actually understand their concerns, and then helping them to understand also why their concerns are perhaps not valid if they fully understand the technology.
Yeah, thanks, Ria. Karen, Tom, any thoughts?
I agree with Wayang. I think that this, we know that memorization is not a good way in medicine, despite the fact that you have to, learn the name of every muscle in the body. We know that you're not going to remember it, and it's not, so why not, and that's, the potential for, obtaining that kind of information now is almost, it changed with the hand phone, but that's going to happen even more. But what it does is it really frees us up to teach other things that are really important in our profession. Communication, synthetic thinking, professional development, and so I think it'll be a real advantage. But for the old medical professors like me, we have to really kind of rethink and be flexible about how we think about education going forward. But this is, so I think, this is a real disruption for everybody, but for us, a big one. And I think, my hope is that we'll take advantage of it, to refine and improve the way we train people in our profession, but also that we participate with the developers in ways that can really harness the potential within our field and others.
Yeah, Karen?
Yeah. So I think in terms of education, so in terms of education, I think memory versus application, right? So I have a son who's 15-year-old, and I grew up by the traditional memorizing, so I can still remember a lot of stuff. And he's like, I can't remember, my memory's bad. But I tested it. So what happens is, I think the new generation is where they are not interested. So we used to memorize things and try to apply that. But this generation is not into memorization, they are into understanding. So when you give them a situation which is totally new, they are able to apply it much faster. But the downside is, of course, they won't remember the other things which are irrelevant to them. What they're interested in, what they are very keen on, you will see that the application is very smooth. Right? So that's one. The second thing I wanted to share is technology in education. During this whole COVID period, I'm not sure how many of you would have heard of HoloLens, which is mixed reality, right? And we work very closely with NUS, we work very closely with NUHS as well. Now, what was interesting is many, many years ago when I tried to give the medical exam, I failed, bombed, because I had to go through like books this big and memorize all that and then, spit it out. But then with mixed reality and using a HoloLens, in some of like Case Western University in the US, they didn't miss a single day of school. They just got their HoloLens, they wore it, they were all in the comfort of their own home, and the teacher was in her home, and you can see these videos on YouTube. They conducted classes, and the learning was amazing, because one of us actually joined in the class, because we also want to see how technology is being used, and the heart. You're learning about the heart, you're learning about the kidney, and you can actually see the heart beating. And you can twirl it around, you can interact with one another, see the heart, versus imagine if you were to learn it on a 2D, trying to find over the left and the right. I'm still very confused, but yes. So you actually see something real, live, in your room, in front of you, and you have all your students interacting. So I think learning is also changing. The way we are moving towards is more with this AI coming in, and if it's going to threaten our jobs, we have to be smarter as well. And I think that's where the evolution is happening from, by-hearting learning or memorizing to how do I apply it? Because the brain, after all, is the best AI you can have in a way. I mean, so far I don't think anything has been created close to it. So how do I synthesize all this information? Using my experience, how do I generate something? Because all these models that we are talking about is being built by human beings. I don't think ChatGPT is building a custom model and saying, hey, I want to, okay, maybe in the future, but right now it still needs the human mind to drive it, to explain what is required, what are the parameters. So I think in a way we are in a stage where even education, medicine for that matter, or in other ways is in a kind of a interesting tipping point where you have technology stepping in and saying, can I make it a bit better? Can I make it a bit easier? And how do I use it? But of course, all technology has a limit. It's never that this is going to be like the thing. No, it's going to evolve. You're going to have different things come in and go. But the whole end goal is how does it make our life easier and better as we all live longer. We don't want to be like living in crutches and all this. We want to be as gung-ho as we are today. So I think that's where technology becomes an enabler. It's not something that you need to resist and say, oh, no. This one, no, I got to edit it. No. I think somewhere we have to kind of adapt and adopt and say, it's going to be like my copilot, and I can decide when I need it, when I don't. But that openness is very important. And I think that's where some of us who are probably more older need to kind of adapt to that. Yeah.
Thanks, Aaron.
I was going to say that, we've talked a lot about teaching and learning for children, right? And I didn't know that all those memorization I had to do was going to be helpful in this way.
There's lots of memorization in law, right?
Yeah. But anyway, I'll think a bit harder about that. But I wanted to kind of like also point out that there's also the potential and benefits, and also the something that employers need to be aware of. I use Copilot as an example. I sat through the whole video, right? I wasn't too impressed with the summarization. I wasn't too impressed with the generating emails. But what knocked me off my seat, right, was the part where they went to Excel, right? And then you could actually give very natural language instructions, and it was generating charts, and you were pivoting at that demo. Now, I've struggled with Excel formulas, and I've struggled with Excel charting. And I know there are people who are Excel warriors who make a career out of that, right? Now, this is going to just pull the rug from under that. And now, this is just an example, right? To me, I see two things. One, there is going to be some intervention needed for people already in the workforce, right? Because while we can teach different methods to the kids, right, there are people who are already in the workforce that needs to be supported. They might need to, some of us can now do Excel as well as the other guy, but some might need to basically upskill, right, and do more advanced Excel stuff, right? The second one is also for employers. You need to understand how the technology that you are bringing into the organization is going to have an impact on your staff, right? So one of the things that we did a bit of work and we advocates is really responsible employers, when they bring the technology in, should also think about how am I deploying it? How am I taking care of the staff who might face certain disruption? How am I identifying the tasks that will be affected? How am I redesigning jobs, right? And how am I supporting people who need training and reskilling? I think that is going to be an important part of the conversation, especially my hypothesis is with large language model, the adoption is going to accelerate because it's going to be a lot easier for companies to use AI than before. So it's all the more urgent that employers need to think hard about these issues: training, job redesign, upskilling.
Yeah, thanks again, William.
Yeah, no, and I just, because in healthcare in Singapore, one of the biggest problems we have is the lack of manpower, right? So the question is actually how do we make use of some of these things to actually focus the existing staff on things where they can actually still value add, or maybe more importantly, even guide the development of the AI tools and some of these other things that's there, that actually, in a way, harness their wisdom for the rest of their working career, but then in that process actually develops a corpus of knowledge that can train the next generation of those who are able to become, in a way, co-working together with the AI tools, but as a result, improving their productivity by many folds. I think that's part of the organizational design that I think will be important, and part of actually like the ability to maybe work with the technology providers as well to understand as well what are some of the implications or some of the ways that the technology has to be able to adapt in order for it to be really powerful or useful for people. I mean, just the example of the Excel warrior. The Excel warrior is probably, who is actually an Excel warrior today should continue to be an Excel warrior, but the question is actually whether ChatGPT is learning from the Excel warrior. Meanwhile, the guy who doesn't know how to do the Excel will just run the thing and then get some of this stuff. Now, the Excel warrior is not going to lose his job, but he's going to be paid a lot more because now he's actually producing for everyone else and not just his own material. Now, and meanwhile, Zikin can then go and do the stuff that he's really good at and not worry about how to generate a chart because the chart will just be generated for him in a few seconds. So actually, it's overall greater productivity that is necessary as our populations age, as we want to, in a way, engage in higher value jobs and higher value. So you think about it, it's like the personal assistant that we all hope we had, and not just a PA, but a principal private secretary kind of person who actually knows exactly what you're thinking and follows up on everything that you try to do. Maybe AI can then be that person and make us far more effective. So I think it's how we think about it, how we frame it, and then how we work with the technology providers to actually ensure that we are providing the tools in a way that at first adapts to what we are used to before it changes the structures of what we are actually going to do in a more fundamental way. I mean, just for this example that Tom had just now in terms of people filling an EMR, I was thinking, that's a great thing, right? So the question is actually whether a combination of nuance that says the doctor talks through and say, okay, this is what I'm thinking, and I explain to the patient, right? That gets recorded into a corpus of text that beyond that, you reverse ChatGPT it to fill up the blanks in the EMR. The currently doctors have to go and figure out, okay, I say all these things, I got to pick out, fill in one by one, right? So that data was used by ChatGPT to generate a report. Now I'm reversing that process, right, to then generate the data. And then of course the doctor still checks through everything and then signs off, right? That form filling process right now, which is so important from the perspective of actually gathering the structured data that allows for the AI to actually then generate insights, right, will now then be automatically populated. So in fact, we are then, how should I say, we are dueling the AI with each other in the sense that, I'm using the same technology to then put more data back into that technology so that technology can generate, even sharper insights for me on an ongoing basis. I think it's how we think about it. I mean, for those of you who know, it's just like how GPUs help us to do a lot of image recognition. I mean, it was meant to translate commands into image, but that same technology translates image back into knowledge or commands, right? So I think ChatGPT, if you can reverse that, actually could become very powerful as well in the other way too. Yeah.
I just wanted to just also add that very quickly, a very short one, that two things. One is that technology, if you really, I mean, we've been talking a lot about technology, but if technology puts you off and you feel, oh my goodness, I've got to learn this and how do I adapt to it, that's not the right technology. And as you just said, technology is something that makes it so easy that you don't even realize it's there. That is what we mean by democratizing technology. It should be embedded in the products that you use in such a way, and I was giving you the example of Excel and PowerPoint, that you don't even realize it's there. You're using it, but it doesn't really force you to kind of really, crack your head and say, how do I use it? And another example I can give you is Power Apps that Microsoft had. Earlier when I was younger, you had to do coding. Oh my goodness, it used to be a nightmare, right? But now you have Scratch programming, just drag and drop. Right at the age of 6 or 7, kids start learning, and then the way coding now is low code, no code. You can build apps, but in a much more easy way. And I think that's where technology is headed. How do we enable the Excel worker, for example? Today, the person is doing it manually and all with Excel, but probably with ChatGPT or with AI embedded, this person is able to say, hey, if this Excel, and I'm making this up, if this Excel is viewed by person X, you're going to have those kind of inputs that are very, that are required by person X. And if person Y, who says he's a purchaser or somebody else, you can see this kind of data. So it slices and dices that data and gives you that report. So I don't think it replaces, and I don't think people need to be wary that, hey, this technology is all mumbo jumbo, how am I going to adapt? It's the democratization of technology is where it gets embedded into what we are currently using, making us more productive. So that is where I think we are, technology companies are looking to assist. Yeah.
Thanks, Karen. For the last, I must say that for the last 10 minutes, I was just trying to think how to interrupt the panel discussion so that I can open the questions to the floor. But you can see like there's so much excitement about this discussion that we can just tell on and on and on. Okay, for the last 10 minutes, I would love to open the questions to the floor. Anyone got any questions like, oh yeah, okay, please, can we have the mic for the audience? Yeah, please. So we have, yeah.
Hello. Okay, I have a question. So I was born before Google came about, right? So, and when Google came, initially, like everyone else, I tried to look for cure for whatever medical problems I came across. And I realized very soon that it's the wrong thing to do, and seeing the doctor is the only option, okay? So now if ChatGPT is going to become smarter and smarter, will the next generation rely on that, and what will be the consequences?
Consequences. Like the law, ask the lawyer.
Remember, ChatGPT is not a search engine. So if you thought that Google, which is a search engine, wasn't good enough, ChatGPT, I guess, is even less fit for purpose. But I guess the key thing really is, yeah. So I guess really it's we need to figure out even as consumers, we need to understand what the tool does, right? And what it shouldn't be for, so that we understand the risks.
I'll just make a comment. I mean, I think I think ChatGPT is going to be used the same way. People are going to put in a question, you know, what I have, my back hurts, what should I do? And if you look at what Google has done to, you know, from the physician point of view, it's made patients much more aware, and they come in and ask good questions. And I think, you know, an educated, informed patient improves healthcare. So, you know, not everything's going to be right. That like when you go to Google, and people are going to have to calibrate how to interpret the information they get. But I think it's inevitably going to be used that way, and we have to be prepared for it. But from the doctor's standpoint, I think we want informed, curious patients, and makes those discussions richer and potentially more useful.
But I was interested in Karen's answer to that ChatGPT is not a search engine.
No, I won't take that bait. What I would say is I'll answer this question from two sides, okay? From the doctor's side, it becomes very interesting. Look at it this way. Let's say if a patient, I'm the doctor, and I'm making this whole thing up, and a patient comes, and I'm just a new doctor, or probably there's a condition that I don't understand, and it's always there. We had last week some condition that was so long that I had to literally search it up. But anyway, the thing is that if we have all the medical, if let's assume, I'm making this up, if it has access to all the medical records in Singapore, and you were to, the doctor were to ask a question, hey, for this kind of condition, can you tell me what are the different combinations of drugs given, and what is their success rate? Just collecting from all the information. So it says, okay, let's say it's a cancer, right? Okay, cancer A, and these are all the combination of drugs given for these profile, and this has been the success rate. Success as in longevity, right? So what I feel is it does help doctors. This is one part, right, where you're saying, what is the suggestion? What is happening? What has happened in the past, right? And then the doctor takes a call. Or in predictive. Because a lot of health now is moving to predictive, right? Is there a way that I can prevent these diseases from happening? So these are the two main areas where I think ChatGPT would be very useful in, if I can use the infamous word, summarizing, and you know who said it, yeah, but anyway, to kind of put all that together. From the consumer standpoint, I think what you just shared earlier is to also educate them. Like, for example, you can say blood pressure, hypertension, or diabetes, right? The consumer can say, hey, I've been having diabetes type 2 for the last 20 years, and then you may have a question around it. What are the long-term side effects? What happens to my kidneys? What happens to this? And again, ChatGPT is not recommending, it's just summarizing for you in a way that, what is it that literature shows? And for example, you could be a person who's a consumer who's more knowledgeable. I would like to know, hey, what does PubMed say about type 2 diabetes patients who've 30 years and above who've had it for 20 years? Can you tell me what does literature say? And ChatGPT might just bring all that out, and you might want to read and make yourself more informed. And then when you go and see your doctor, you might say, hey doc, what about this? I read this, what about this? So it's a very meaningful discussion at a much higher level. Because many of us, when we go to the doctors, it's like doctor says something and say, okay, I don't understand, okay, fine, go. But now, the caregiver can actually actively participate in the discussion with the doctor and understand why is the doctor recommending this, what is the nice thing, or whatever. I mean, it's a very meaningful discussion you start having with your doctor. So again, to your question, it's not a search engine. It's, I would say, in a way, it's summarizing the data that's already there. Again, with all the caveats of the model that is being trained on, that is why custom-built models are better. Right? Because you can control the parameters, you can control the data set, but yes, it is a kind of a copilot, or I would say a skill that, or a kind of a small, if I can use the word, weapon in the hands of the doctors that they can pull out as and when they need. It's never going to kind of replace or, kind of remove any skill that the doctor has.
Just one follow-up. I mean, I think as was alluded to, I mean, the accuracy of the answer depends on the information that it's searching, and not everybody's going to know enough to say, oh, I want the information from PubMed, right, where maybe that's peer-reviewed literature. So I mean, I think there will still be the same sort of misfires that we see for people searching the internet. But I do, as I said, I think that's a healthy conversation to have.
Yeah. How many questions can I have? Okay. Yeah, I asked two. The first one is, like, for example, the ChatGPT, like every year or every now 6 months, like the new model come out. So for we are talking about we coming out with a plan for our future generation, because I have the one son, 6 years old and 4 years. So which is what should I prepare? And maybe the medical regulation and education are keep evolving. So the question is every time the ChatGPT new model come out, the regulation or the training material will be updated every year, every now and then, or what do you see and how to prepare for the future? This is the first question.
So maybe I just trying to answer. You're saying how often should we be refreshing? Yeah, no. So I think a lot of these things you just have to be then adaptive, lah. Yeah, right. So you have to be. I think you have to be adaptive. How should I say? There are. I think this whole idea of the structured models, the ones that are scoped, those then require it to have learned off the material for a period of time. Then the question is actually, you have the updated version. If you actually apply it, would it be as accurate? It's not clear. But of course, over time, I'm sure it'll be better. So I guess some of the things you have to decide when you switch versions, and of course, what's the knowledge, what's the learning base, and how that is then in a way probably validated against the old model before you replace the old one with the new one. I mean, those will be some of the things I think would be necessary to decide what is the frequency of change, right? And of course, then if you are talking about what are skills we need to then train people, the reality is that maybe last time the learning cycle was 15 years, now it's 5 years. Where when I was doing my MBA in China, we were told about, it was 1 year business models, they were updated every 6 months, when they were at the heyday of their tech boom, right? So the question is actually the learning cycles, the time cycles really depends on the environments and the tools that you have. And of course, if the learning cycle is very fast, we then have to also ask ourselves, how would we organize ourselves as a human society in order to meet that kind of thing? Is it the case that I will always allow people to use one generation of technology for 5 years, because maybe ending beyond that, it really becomes very unproductive, but then have overlapping generations of groups of people who are actually being trained on different technologies, but still organize ourselves to be able to function, despite that's the nature of how we organize ourselves. So I think some of these things are, it goes to the root of, as technology changes, how do we organize ourselves, and whether or not that organization is actually going to be something that humans can accept. Because in the end, we are still a human society where people vote, and if people don't like what's happening, they vote you out. So, I mean, those are some of the realities. I don't know whether it's the case. Anything else?
No, nothing much. I think what you pointed out is really shortening of the cycles, right? I don't talk about the education. I think Wei Yang has dealt with it. But I think for a lot of us who manage systems, you don't make changes with every new update. You kind of like pick the right one, right? Because there are a lot of work you need to do, because you've done a customized model, right? Just because the new version comes out of your large language model doesn't mean that you immediately chase it, right? So you make a decision, you figure out what's the best balance of resourcing, right, and testing that you want to do, and then you decide whether you want to upgrade. Sometimes people skip one generation. It's really up to you as a system owner.
Yeah. So, any more questions? Yeah. So the gentleman behind.
Sorry. Okay. Sorry. Yeah. Let me just ask a simple question. It's for sure when doctor sign off the report, 100% he'll be responsible. Whether he's busy, whether he's lazy, whether he's tired. When he signs the report, he makes reference to ChatGPT's report. He'll be fully liable for that. So the next question is that's for sure very clear cut. The next question is would a hospital or a doctor counter sue the service provider, the ChatGPT? Because ChatGPT cannot be accurate in terms of 100%. We measure AI by 60%, 80%, 90%, but it makes mistakes. So what is the responsibility of the ChatGPT? Yeah. ChatGPT is being sued now.
Yeah, my tongue-in-cheek question is, you have to read the end-user license agreement very carefully, but...
If I understand your question correctly, I think wherever we use AI or ChatGPT in healthcare, right, the liability is always on the doctor. Because, because we are not saying, and I think in Microsoft we are very clear on this, and we have what we call as a CELA, which is the legal, which says very clearly that you are in no way to use these tools for diagnosis. You are to use it as a co-pilot, and it's the doctor's decision to totally rubbish whatever ChatGPT says and say, no, I don't think this applies to my patient. And so that is the mandate that we have, and we maintain that the doctor's viewpoint and decision is final. This I'm talking specifically from a healthcare point of view. From the other industries, I don't know. I work in the healthcare sector. So definitely the liability for usage of any AI models, for that matter, lies with the doctor. And that is why I was saying earlier, any ChatGPT usage, it is better if it is customized, because then it's controlled. It's a controlled environment. You know what input goes in, and what is the output. You can test it, see what is the accuracy. And I think anything that is less than 95, 97%, normally those models don't see the light of the day in healthcare. So it depends a lot on a very controlled environment. Think of it like a science environment you're doing in the lab. But again, despite all that, it is still the doctor who has the final say.
I'll just add on to what Karen said. So like, if you see how AI model is being deployed, right? So we talk about assistive. So meaning that 100% is a doctor's responsibility, but there's also a fully autonomous way. Then that questions, so you go back to Wei Yang's point, right? The product disclaimer. So what does the product claims they can do? Is it like fully autonomous? Is it gonna be assistive, which is like 100% doctors going to be the one making decisions, or is it going to be a hybrid, right? So I mean, this is some of the regulatory aspect that US FDA has actually kind of, the SAMD, the guidelines has actually said. Yeah, well, yeah.
I just also want to add, a large part of it is also how we then design our system, right? Just to give an example, even it's 97% accurate, but one way is that we use it as a filter, right? And it helps me to filter, people, basically those which I say I have 90% confidence, I'm not sure, then basically these people the doctors will see. Those at 98, basically I'll say, okay, maybe I'll run 1 or 2 more diagnostics and usually it'll be good enough. But that requires us as a system to change our own processes as well, such that when we use it and we know the limitations of the date of the tools, we are able to also give the kind of assurance that, and in the end, it's also about how effective and cost-effective the system is, because I could be extremely accurate, and actually you see long queues, and now you're able to see your doctor for the next 6 months, or I can say that this way of doing it, I can see all of you within 1-2 weeks, right? Because most of the previous cases, basically, I've said don't come back again until maybe some of these things happen to you, right? But it goes back to, at the system level, we must understand that that's where the affordance comes, that the value to the patient is actually, yes, you might feel like, how come the doctor never see me? But actually, the reality is that when the doctor really needs to see you, you can be guaranteed that they will see you in the kind of time that you might expect, right? And that we have to explain, that we have to get the doctors to also accept, but that also requires us to be able to collect some data over time to also show that indeed, this technology is helping us to be much more effective with the resources that we can actually afford.
Yep. Any more questions? Yep. My question was asked. How much time more do we have? Okay, last questions.
Okay.
Saving the best to the last. All right, yeah. Sorry.
Good evening. I'm year 1 Duke US student, Prof. Thomas. Okay, my question is, currently ChatGPT is generative text. What will be the next? Because currently we have Stable Diffusion, Midjourney. If generative medical image mixed with the text, because just now you have mentioned there's answers, you can generate the exam questions. If we have a report, can we generate medical images? If we have CT, can we generate MRI? Because you see some of the image with medical radiations, but we can use the non-radiation images to generate those radiation image. One MRI scan can be 20 times to the X-ray, 10 times to the CT scan. Can we just use some of ultrasound scan to generate CT, MRI, so we can reduce those medical exam costs to the patients? That's my question.
Yeah, I'll probably just respond very short on that. So 2 ways that it would go. One is, of course, we have seen that whenever we introduce a technology into the market, the users are amazing. They create use cases and they build on top of that, because I said it's also available on Azure open source. So a lot of developers, a lot of consumers are also kind of, embedding this technology into other forms. But from Microsoft's standpoint, what we're doing, as I said, is we're going to kind of move it from speech to text, and text to reporting, or text to summarizing, or text to kind of embedding that intelligence. So that's where we are looking at. But we're also going to go down the route of videos, being able to kind of use that in videos, be able to, and the idea here is to kind of have people who are the vulnerable community be able to use technology. So for example, be able to help somebody who's blind, somebody who's deaf, to be able to use these technologies very easily. Imagine somebody who's blind be able to use PowerPoint. So those are some of the areas where Microsoft is trying to move ChatGPT into. But then again, the world is a playground, so we do see interesting use cases of how people are embedding ChatGPT into amazing applications and coming out in advancing that technology. That's why you see we are at GPT-4, because of the way it has just exploded. So I would say, let's look out and see, what the future holds. Yeah.
Maybe I'll say that this way. I can imagine a world where, based on some of the statistics, I can generate a synthetic image that I will not rely on for diagnosis, but that I could add to the entirety of my data set, so that my data sets are actually more complete. And then I'll run AI models on the more complete data set, so that I will generate deeper insights and more accurate insights. I would never use such a generated image for diagnosis, because each individual, that's the reason why we do the imaging, to tell us actually that if there's anything that might be amiss that we wouldn't have noticed using all the other tests that have already been done so far. But I can imagine a situation where by generating the synthetic data of all the other statistics or all the other tests that I have not generated for that patient, I complete my data sets in terms of the dimensionality of the data set so that the AI that gets run on this full data set actually gives me much more powerful results in terms of the insights it tries to generate. So that's where I might use that. I would hesitate to use as a part of a diagnosis. Yeah.
No, just to pick up a point, actually synthetic data is here, right? And actually it's got a very good use case, testing, pre-launch testing. Because you then are able to make use of that because it's representative of your population, and then you can actually do more thorough testing before you actually release something. So I think it's a very, very pertinent point and relevant to our discussion.
Yeah, I don't know why I started getting very concerned about the music producers, like the composers, the musicians, because, you know, all these things, right? Can ChatGPT generate songs? I don't know, right? I don't know, sorry to digress. I know we're talking about health, but I started getting really concerned for them. Okay, coming back to this, I would like to just close the session, right? ChatGPT, is it ready for health, right? From 0 to 5, 5 being super ready, 0 is not ready at all. I'm just going to ask the panel the last question. Useful, okay, useful or not? Okay, go to Karen. Okay, thanks, Karen. Okay, Tom, what do you think? 0 to 5.
0 to 5 where we are right now. Yeah. Oh, I think we're 1 or 2. I mean, I think we've got, you know, the potential is great, and we've only scratched the surface in terms of what it can do.
I'd give it a 6. with one caveat. No, with one caveat. I mean, hear me out. I'd give it a 6 with the assumption that this technology is in the hands of extremely super smart folks sitting here. And I've seen it because I explained to you the mixed reality. We developed a simple HoloLens, and when we gave it to the doctors of NUS and NUHS, mind-blowing, even like we were like shocked the way they used it. So I would give it a 6, given that it's going to be used by super smart people that like in the room.
I'm pretty sure you're going to get a raise after this panel discussion. I'm sure someone there is listening. All right. Yeah.
I would say probably.
Oh, now you start thinking. Am I saying like a panel or like a DS?
No, I think I would say right now it's probably not quite there yet. I think eventually. Probably about 4. I mean, keeping in the scale, but I think it requires not just smart users, but responsible users, and that smart and responsible users co-developing together the technology people, and then understanding also the limitations of the technology. So I keep going back to that. Yeah.
Well,
okay, what do you think?
I'm probably too.
You're more strict, right? Like Tom.
Two-ish, because you see, we've had a very good discussion of the potential, right? Yeah, but actual use case, actual pilots, and actual deployment, right? Yeah, so it's the potential is there.
I mean, I was just saying where we are now, and obviously I've seen all the Terminator movies, so I have that, you know, I'm a little scared about it still, but I think the potential is unbelievable.
Okay.
Yeah. If anybody's interested, please reach out. Happy to kind of demo to you. It's a long way to go, but there are a few very interesting use cases that we have already developed, and we're using it through the Microsoft products. And if any of you are interested, happy to show it. They're all like baby steps, not some real, you know, like the Terminator stuff yet, but yes, happy to share it.
Just a financial disclosure, we're not being paid by Microsoft to conduct this panel discussion. We should have mentioned it very early on in the, yeah. Okay, with this, thank you very much. Can we give all the panel a round of applause? Thanks very much for spending the night with us, and thank you audience for coming, and it has been a very great session. Thanks very much. Yeah.